by asking anybody who's got the letter from Blue Cross Blue Shield that their plan is being canceled in December to raise their hand. All right, so we got 3. How many? The Medicare, the Blue Cross Blue Shield PPO is being canceled on December 31st. 47,000 individuals enrolled in that plan that are now scrambling. In that letter that you got, it said, call SHINE. I cannot handle 47,000.
Does that include the Sapphire plan?
No, that is Blue Cross Blue Shield PPO, Medicare Advantage plans. Yep. The Sapphire, the Core, those are all off the table. We don't have to worry about those. There's also some people in here who may have received a letter from Tufts saying their Tufts plan was going away. All right, so nobody in here. All right. So what I'm going to ask you 3 people here to do is, I cannot answer for you what plan is going to be the best replacement, because I'm going to have to ask people in that situation to contact their providers to find out what plans they're going to be in next year.
The one I got said it, I think Tufts was one of them, I don't remember offhand, but were 3, I think, that they...
When we say Tufts, that doesn't do me any good, because there are 6 different Tufts plans. And not all doctors are enrolled in each of the plans. So we can help you find the plan, but you have to do that proactive and find out what specific plans your provider, especially your primary care, is taking. Because those networks can exclude certain providers. So that would help us.
Have you read it?
What, the Tufts letter?
No, the Blue Cross.
Yeah, I've read it, the 12-page letter, I've read it. And I actually sent a little kind of nasty take to the state office that runs the SHINE program, because Blue Cross put in there to call SHINE.
Mine doesn't say that.
All the way on the back page, call SHINE. But we didn't know that 47,000 people were going to be losing their plan and calling SHINE. Well, manpower, we can't handle it. And I don't know if this senior center is getting any of those calls, but most of the other senior centers are getting overwhelmed by those calls. Anyway, we can talk about it, but there's a process, okay? So now we still don't know what Medicare Part A is, hospital coverage. When you're turning 65, we're all eligible for Medicare Part A. Some of us will have to pay if we don't have enough of 10 years in Social Security. You'd have to pay. But for most of us, we've prepaid it. It's not free. It is a prepaid benefit. If you ever looked at your pay stub and you were paying the Medicare tax withholding in your pay, so you have prepaid for Part A. Part B currently has a base premium, excuse me, of $185. But that can be increased by what they call the IRMA, income-related monthly adjustment. If your household income is over certain thresholds, it increases up to 4 or 5 different times. That IRMA adjustment is also added to your prescription plan. Okay. Is everybody in here on Medicare? We have somebody that's just new and looking to get going on it?
It's not me, but I'm here for my son, who's turning 65 in January.
Okay. So if he's working, and currently on an employer group plan, so he's working and not covered by any insurance from an employer?
Yeah, Mass Health, but he pays for Mass Health.
Okay, at 65, Mass Health will force him to go on to Medicare. So in order to get onto Medicare for January, did you say his birthday? Then he should be calling Social Security now and enrolling in Medicare for January 1st.
Well, he got the little card and all that.
Oh, so then he's already on Medicare. So I don't know. If he got the card, the red, white, and blue card, it would tell you he's on Medicare. What days does it say? Yeah, so he can consider different ways to supplement that, but if you're telling me he got his red, white, and blue card, he's on Medicare. Without specifics, I can't answer. So a call to Susan, or whatever. Yes?
I'm turning 65. My husband's still working.
And you are on his group insurance?
Yes, I don't work.
So there's not anything that you have to do. You can contact Social Security, enroll in Medicare Part A. There's nothing.
You don't have to.
You don't have to, all right? As long as you are covered by employer group health plan of your own or a spouse, then you don't have to do anything. Go ahead.
I had a question. I have a disabled child who was on Mass Health, and then they just put him on Medicare. Will that be affected if I signed up for anything with Medicare? Like how much he gets a month or whatever?
No, Medicare has nothing to do with Social Security money, disability money, anything like that. Two separate animals. Unfortunately, people get it confused because you have to enroll in Medicare through Social Security.
Okay.
They're where you go to buy the product, and then they send the information to the Medicare
I have another
agency.
question. Someone told me to sign up and get benefits when I turn 65.
What benefits? What do you mean? Sign up for what and get
Get
what?
money, to get Social Security check or whatever.
Well, that's a Social Security issue. If you have paid into Social Security, you can start collecting your Social Security retirement benefit at age 62, but you'd get a reduced dollar amount. I'm assuming, how old are you?
I'm turning 65.
Okay, so then you what?
I don't want to say it out loud.
Yeah. So I'm going to make an assumption. I don't know the specifics, but I believe that your full retirement age would be like 66
That's
years
what I
and
heard.
8 months or something
Correct.
like that.
Okay.
All right. So at 66 years and 8 months, whatever benefit you're entitled to from Social Security,
Right.
you'd get the full. If you take it before you turn full retirement age, it's going to be reduced
Okay.
by about 8% each year, all right? So, but then you also you should talk to somebody, because if your husband is a certain age, you might be able to collect on half of his. So you need to talk specifically to somebody at Social
Still working,
Security.
and he's not planning on retiring.
Well, no, that doesn't matter, his benefit.
Okay.
Because as a spouse, it's the higher of yours or half of theirs. There's a calculation. I would go to Social Security and talk about it before you do anything.
It's impossible to get an appointment if you've ever been down there.
I just got a text last night, I'll show you, on how to get through to Social Security. Okay, so yeah, Social Security and Medicare are two different animals.
Okay.
You can go on Social Security at a reduced benefit at age 62. Your full retirement, you get full. Medicare, we're not entitled to until age 65, unless you've been on disability.
No.
Okay, so yeah. Talk to Social Security about your retirement benefits. That's not my...
How'd they tell you to get an appointment, because you can't get in there and get an appointment?
Oh, you mean, but you can log on to your own Social Security account, and the information would be there.
All right.
You know, ssa.gov.
Yep, I know.
All right, or you can call the 1-800 number, which I really don't recommend, because that's the national number. And once you get into the National Social Security database, sometimes the little offices, the local offices, get a little bit of, they're going to the national, and they don't really want to pick up the pieces because they don't want to coordinate the benefits. But Social Security, Medicare, two different things. But you don't have to do anything if you're covered fully on an employer group plan.
All right, thank you.
I'm going to piggyback on her question. I'm planning on working until like 70, but people that do the same thing as me, whatever, we're all in the same group plan. They're all telling me, even though I did the chat, I was telling you, and they said you don't have to sign up. Like I did the chat on, the, so I'm like, okay. Then I was telling them, and they're like, oh no, if you don't, you'll be penalized.
That's what I heard.
Yeah, so then I got all confused
Yeah, so
about that.
that's why you talk to a SHINE officer and not your neighbor, not your Aunt Margaret. No, everybody has a different scenario. Everybody's got this fear. You will not get any penalty at 65 if you are covered on employer group coverage or your own or by a spouse. You don't have to do anything. If and when that employer group coverage starts to go away, if somebody retires or they retire you, you've got certain periods of time to sign up.
so then
And
you get the-
you get what they call a special enrollment period, yes.
didn't get that. Okay.
Yes. So when somebody leaves group coverage, You have 8 months to sign up for Medicare Part B. And, you know, most of us to avoid a penalty. But you don't have insurance coverage for that 8
But
months.
Part A as well too, right?
No, Part A, there's no penalty for Part A. You've already paid for Part A. There's no penalty for Part A.
Oh,
It's
okay.
B.
It's B, so Part
It's
A,
B.
you don't have to sign up for it.
You don't have to sign up for it. You can. Sometimes people get the warm and fuzzies because they've already figured out how to contact Social Security and get their number. That number stays with you. You're not, it's no cost, so there's nothing out of your pocket that you got to worry about. What it does give you is, should that employment coverage end quickly like that, it gives you the ability to get a prescription plan within the 63 days without getting any penalty. So everybody's situation is different. Part B, there would be a penalty if you don't sign up at the appropriate time. If you're on, we've already talked about employer group coverage. You have 8 months from the ending of the group coverage. If you're turning 65 and you are not on any group coverage, excuse me, and you don't sign up for Medicare Part B, either 3 months before your 65th birthday, the Part B, not A, the 3 months before your 65th birthday, the month of, or 3 months after, you have now missed your initial enrollment. And because you're not on employer group, you don't have a special enrollment. So now you have to wait for general enrollment. You have to wait till the following January to sign up. So you would be without Medicare, without supplemental coverage for that period of time.
Okay, so we don't have to, but we can.
Sign up for A.
Okay.
Yep. The only time you wouldn't want to sign up for A is if you are contributing to a health savings account through your employer. All right, if you're contributing to a health savings account, not a flex spending, a health savings account. Flex spending you have to spend before the year is out. Health savings you can keep accumulating.
My husband has one of those health savings.
Then you don't sign up for Part A until you stop contributing to that.
When you say sign up, what do you mean? Where do you sign up? You're gonna,
Social Security, Medicare. When you enroll, it makes it easier to enroll. You enroll through Social Security for Medicare. Call them or visit an office. You can get papers online. There's certain forms to do that. You can drop them off. There's multiple ways. You can do it on your own SSA.gov account. There's multiple ways. Okay. All right, so now we have A and B, right? So as we know, Medicare, A and B, and you'll all start to get, I thought as I got older, this was all going to be free. Medicare Part A, currently, I don't know what it's going to be in 2026, has a deductible. That's the hospital coverage, hospital only, room and board. As currently, if you were to be hospitalized and all you have is your Medicare red, white, and blue card, A and B, as soon as they're wheeling you down, the billing department's going to be looking for $1,697. That's your deductible.
That's 2025.
2025. I don't know what it's going to be for 2026. Okay? Now, that deductible is not an annual. If you were in the hospital and then 2-3 months later you go back in, that raises its ugly head again. Every 60 days between hospitalizations. So that's why we try to cover that sort of nut. Medicare Part B is doctors and durable equipment. You know, you might get your test pads, test strips for diabetes. That's covered under Medicare Part B, even though some people get confused that they go to the pharmacy and think they're getting it by prescription. It's being covered by a different part of Medicare. Okay? That currently has a minimum cost of $185. And it can raise its up into $539 based on if you had $750,000 of household income, it would be $539 a month for each individual of the household on Medicare. So it can get very, very expensive, okay? And again, I don't know what those numbers are going to be for next year. It's not out, it's probably out, but because the government shut down, there's nobody working to announce it. I'm sure the numbers have all been decided, but it's not, the information's not coming forward, okay? So as Medicare pays 80% of approved charges, here in Massachusetts, we're lucky that if, let's just say you had a $100,000 hospital stay, you owe the $16.97. Medicare will then take that off. They will approve, let's say they approve $80,000. The hospital cannot do anything to you with the rest of the money. They have to wipe that off. But then Medicare is only going to pay 80% of the $80,000. The rest, the onus of the rest is on the consumer, okay? That's where we come into supplemental coverage. You buy private insurance to cover that, or you can go with what they call the Medicare Advantage plans, the ones you see mostly advertised on TV. And I gave those out to, I got a few. I mean, if you want to share them, can you share that? Can you guys share that? If there's enough, we'll pass the second one around. What I want you to, and I think it might be page 9 in this booklet. This is old 2025 information, so. Yes, that's the page I want you to turn on to. That's the colored page, right here. Somebody else need one?
Yeah.
All right, there you go. Okay.
Oh, thank you.
These are old numbers, so it's still effective right now, but not into the future. There are 2 ways to cover yourself when you are on Medicare. You need to have 2 different ways. Medicare, this in the right-hand column, that's called Original Medicare. In the green box, you have Original Medicare, Part A and B. And we'll go with the basic. Medicare Part B costs $185, okay? Those are the 3 plans to cover the 20%, called the Core, Supplement 1, and Supplement 1A. All right, those are private insurances. In Massachusetts, there are 7 companies that sell those private insurances. And I actually have the current information for them.
That's Part D, is that what that is?
Nope. Part D is prescription coverage. These are what's called Medigap or supplemental coverage. These are the real numbers on the front for 2026 for the plans, but the back numbers are not current. You want one too? Okay. All right. Medigap are private insurances. These are the fixed prices. You can, when you enroll in those, you have covered supplemental. The Core, which is a product, is the least expensive. So you get the least coverage. The Core plan does not cover that hospital deductible that I mentioned. So if you're a gambler, like to take a risk and you can afford it, the Core plan for somebody entering into the world of Medicare can be the way to step in, all right? In Massachusetts, all of those plans have continuous open enrollment. The middle one, I believe, is Sapphire. Yeah, Sapphire is the middle of the plan. So the Core does not cover the Part A deductible or the Part B deductible. It has that fixed premium.
Are you
but
right, Jack?
I'm here on Core.
Cool, okay.
Core plan, okay?
I'm just confused by something because the one you just handed out looks like it's exactly like this one here that didn't have the most recent.
No,
That's the same one. I don't know. The same one. Yeah, that's the same one.
I got a preview.
All right, Sue has a bigger budget, obviously. She printed in color. I don't have that.
This is why there's 2. Is this core plan equal to this year's Blue Cross Blue Shield Saver?
There's no such thing as equal to anything. Your Saver is a Medicare Advantage plan. There's no comparison between either.
And that's deleted this month.
I can't remember, but these are totally different from Medicare Advantage plans. They don't compare at all.
And this is all they have this year.
No, it's not. These are Medigap plans. They still have Medicare Advantage plans. We haven't gotten to those yet.
I get it, okay.
All right? So back to that orange and green page. These type of plans are the ones that cover you for your supplemental coverage, okay? It's up to you to determine how much risk you want to absorb on your own as to which level you buy, okay? You don't have to, excuse me, compare anything with these 7 plans. They are all exactly the same. You don't have to say, does this one have dental? Does this one do this? They only cover exactly what Medicare covers. There's no other carrots. There's no co-pays, there's no referrals, there's no networks. You are in control of where you go, who you see. You don't have to check if a provider is in the network, okay? All right, you guys seem to be struggling.
No, we need another one, if you have another one. I'd like another one, on different pages.
All right, I need one too. I got one more up for grab. It's gonna be bid, highest bidder.
Maybe so, like,
All right. Those Medigap plans are a personal choice. As I just said, by law, every one of those plans has to have exactly the same coverage. What they don't have to have is the same price. If you look down that core, you will see that each one of the plans, although the insurance, is exactly the same, the prices vary. So as a consumer, it's up to you to do a little bit of, advocacy for yourself as to what plan, all right? There's no loyalty except for the price, all right? There's no reason, I see no reason to pay $40 more for United than get the same coverage from Blue Cross on these type of plans.
Good to know.
Don't look at anything with the Medicare Advantage. We're in a different world, okay? With these type of plans, you now have hospital coverage through A, doctor coverage through B, the 20% supplemental coverage from the plan. What you don't have is prescription coverage. You have to buy that separately when you go this route. And I can't even give anybody a dollar amount for what their insurance would be on the prescriptions without knowing exactly what prescriptions you take. It's all individual. Excuse me, you would go on to the Medicare, what they call the plan finder, punch in your medicines, punch in your zip code, punch in the type, where you'd like to go to pick them up, and then it will churn that information and spit out to you the least expensive. I'm not going to say cheap. I'm going to say least expensive. Okay? Plan. You have a question?
Well, I just wondered with the out of the U.S., it seems that Blue Cross covers it on the core, and it doesn't seem like HPHC.
Correct, they don't. They don't.
Oh, I thought it made it sound
No.
like everything's the same. So
Under Medicare, all of those other things are different. Those are those carrots, I call them.
okay, so
I
the
call them carrots, yeah.
Medicare. Okay.
Okay? All right?
So you just talked about the core, right?
I talked about core specifically.
Okay, so
Then there's 1A, which is a higher level.
a higher,
So it pays that Part A deductible for you where core did not. You're paying just roughly $100 more a month, so like $1,200 more a year, but you don't have that $1,600 hanging over your head if you get hospitalized.
Okay.
All right? It pays that. It doesn't pay the Part B deductible. The only plan on that pays the Part B deductible is called the Blue Cross Bronze, and you have to be of a certain age to be able to get that from anybody turning 65. You're not eligible. But even then, financially, it makes no sense to pay $650 more a year to save the $259. So I'm not going to get into that. Any questions on that?
You mentioned Sapphire was the middle column?
Yes, Sapphire 1A. Supplement 1A. Blue Cross, it's called Supplement 1A, but Blue Cross's product name is Sapphire. Not all of the companies have the same name for their plan. It's the level of coverage. All right? Now, I say Blue Cross, I'm not promoting Blue Cross. I don't have any bias towards any one of them. The insurance coverage is exactly the same. What I have an issue with is why somebody's paying $40 more for the same product. That's all.
Yeah.
All right? Makes no sense to me, but hey, people will say to me, literally, oh, but United was so nice to me when I called about my mother. Is your mother still here? We don't have to worry about that. What's best for you, okay? What's best for you? Are there any questions on those type of coverages? Again, reiterate, there's no network, there's no referrals, there's no $5 when you go to the office. You will have only the $259 over the year to cover on a doctor. Your fixed premium, so you know what your medical cost is going to be for the year, all right? Anybody have any other questions on those type of plans? The least expensive plan for prescription coverage, premium-wise next year, is going to be a plan called Humana. It's going to be $8.40. But I don't recommend anybody just jumping into it because the least premium, you've got to make sure that the formulary covers your medicines. All right? So that is where a SHINE counselor, that is where the SHINE counselors shine. So I don't know if you passed these out, the prescription search forms?
Well, we'll do that
Okay.
so far, yeah.
If you can pass them around, all right? Just take one. Those are what the SHINE counselors would use to review your Medicare account and recommend which particular prescription plan would best serve your needs and recommend whether you should change from the one you have to the new one. Every year they change. So open enrollment comes around every year, and there's so many changes that take place year over year. People say, oh, it's working for me, but again, the formularies change. Usually in October, you get the letter saying we're up in the premium, we're reducing the premium, we're removing this drug, we're doing that. So you do have to look at it every year. If you don't want to go through the process of sending this into a SHINE office, you all can log on to Medicare.gov. That's the website. You can set up your own account using your personal Medicare information. Input your drugs and do as I said. It will churn the information. Any one of you have a question, you can give me a call and give Sue a call on how to go through that process. All right?
Is it typical for an insurance company to say, if you cancel your account with us, you can never come back?
I don't know.
Oh, yeah, see, I got my Medicare through my retirement.
Oh, yeah, that certainly can. Oh, sure.
Yeah.
Yes, once you drop retiree coverage, they really don't want.
It's a PPO through Blue Cross Blue Shield, and I've had it since I retired, since I turned 65. And, they typically say, if you cancel it, you can't come back
Right.
to the program. My wife and I have seen our premiums go up quite a bit, just since we got in.
Welcome to the real world.
Yeah. I mean, we're going to be close to $400 each a month just for our, yeah, is that pretty much?
Well, my husband and I each $185 for our Part B,
Yeah, we do that.
right? $141 for my Blue Cross Core. My prescription, I don't take any, lucky for me, is only, was 50 cents last year, but I don't take any meds. Next year it will be for $8.40, even I still don't take any meds. I have to have that plan. But his meds, he's on a plan that costs $131 a month, plus the copay when he goes to the pharmacy. So yeah, $450 average for each of us, so that's $900 a month for us to stay covered on Medicare.
And that includes your social security,
Both together.
185?
No, $450 each. $900 to keep us on Medicare.
And your social security is
Are you including what they take out of your social security?
Yeah,
staff?
yes,
Yes, yeah, I do.
yeah, yeah. So that's not out of the ordinary. It really is not. Now, the way around that is, and there are programs called Medicare Savings Programs, which can help defray the cost of some of that. They pay the Part B premium if you have income qualifiers. Right now in Massachusetts, the income for a household would be $3,966 to be eligible for that plan that would pay the Part B premium for both. All right, so that's a cost savings. And it gives you what they call extra help for prescription plans. So that's a big cost savings, but that's only here in Massachusetts, and that's not the same on the federal level. Federal says we have to do so much, and Massachusetts blows it up. So that is a big savings for people on the income. You could have $1 million tucked in your mattress and still qualify. It's based only on the income. But that's and that's what one of the questions is on my form. If you see it here on the form, all right, have you applied for it? This is this. So if I see somebody that comes in and looks like they might be eligible for that, I will do that first and get them on that program before I would do any enrollment in anything else, because it would save them money, okay? All right.
Medicare, I got the impression that if I don't do it now, I can't do it without going through a lot of...
No, in Massachusetts, it's 100% constant open enrollment for Medigap. There's no underwriting, there's no questions, there's no pre-existing conditions. That's in Massachusetts. That is not outside. That's Massachusetts. All right? But if, again, how much of a risk taker are you if you don't have the supplemental coverage and something happens? You're on the hook for the 20% of whatever it is, okay? But no, Massachusetts is quite liberal in how they do it, okay?
Jump in. Okay.
Yes, you could jump in. What you can't do is in the middle of the year decide you don't want the Medicare Advantage plan anymore and then go. When you're in a Medicare Advantage, you're in for the year, okay? All right, so on the purple side is the Medicare Advantage side. Now, Medicare Advantage plans are, most of them, HMOs, network-specific referrals. The PPO allows you to go outside of the network, but you're going to absorb the higher cost. You're not going to get the same break in the cost if you're on a PPO. What's happening this year, or for next year, is concerning because these Medicare Advantage plans are deciding primary care physicians are jumping out of these plans. So they're jumping out of the plan, so where do you go? Insurance is going, the primary care, and that's why I said to you, find out from your primary care if that's who you want to stay with.
Well, I think I can do Medicare, traditional Medicare.
Traditional Medicare.
And then a Medicare.
Right.
Yeah.
So anybody who's losing those plans on December 31st, if you don't do something before December 31st about opting for another plan, you will be bumped back to original Medicare. But you will not have supplemental coverage and you will not have prescription coverage. So before December 31st, you have to do both of those things to be in place for January 1st. All right? So again, that form can be very easily submitted. But you have open enrollment usually ends on December 7th for everybody traditionally if you're just looking to change your prescription plan. But anybody who got that letter that their Medicare Advantage is being canceled has an extended open enrollment till December 31st. And then if you don't do anything, you'll be bumped back to original. And then you still have the opportunity till February 28 to join another Medicare Advantage plan if you choose, or go to the Medigap with prescription. Okay? Anybody else have questions? Those Medigap, what county? Are we in Norfolk County or Plymouth County? Okay. In Norfolk County, I don't have very many. Those Medicare Advantage plans are sold by county. You could live in Plymouth, your sister can be living in Plymouth, and you live here in Cohasset, and you both want the same insurance, but it may not be sold in that county. So you've got to look specifically. If you got your Medicare Renew, I saw somebody that had the Medicare Renew book.
Yeah.
Yep, you'll see those are all sold by different counties. If you look in the back, page 122A. All sold by different counties, Worcester County, Eastern County, Suffolk County, Norfolk, always different plans. The costs run different. These are the plans that if it's an HMO, you have to stay within network. If you go outside of network, they will not pay. If you have a PPO, you can go outside of network, but you'll pay a higher cost than if you had stayed within the network. You have to, if you on a plan and you want to stay with your primary care physician and it's in turmoil, you need to find out what plan they're going to be going on to next year. Because if you start with a new Medicare Advantage plan, you have to start with a whole new network. You've got to get yourself set up with a primary care physician. And I'm sure all of you in here know how difficult it is to find a primary care physician. And, you know, oh yeah, we have an appointment available next November 13th, you know, that kind of thing. So really look hard and fast. If you want a copy of this, I have a few. If you don't, I mean, you can find this stuff on that Medicare.gov website.
I have a lot
You have a lot? Okay.
of all of this.
Okay, okay. You can go on the Medicare.gov website and play around with this. You can put your medicines in. You can toggle between standalone prescription plans if you're going to go with original Medicare and a supplement, Medigap supplement, or you can toggle. Okay, let me look at the Medicare Advantage plans in this area. Let me look at the Medicare Advantage plans within a certain dollar range. You can figure that out. Now there's a new feature which just came up 2 or 3 days ago, which is really good, but the website has been down for 2 days. Medicare website, total. I even called Medicare and they couldn't get in. You can put your name of your primary care physician in that. If you're looking for Medicare Advantage, you can put your primary care physician and then filter with only plans that he's in. Now, this all sounds hunky-dory, except if those websites are not keeping up to date, there is a new out. Medicare is allowing, if you chose a Medicare Advantage plan based on the plan finder telling you that Dr. Smith is in this network, and he's not when you go to make the appointment in January or February, all the way, you have now another special enrollment period to change. That runs all the way through December, Sue. So only if you enrolled in that plan through the plan finder, if you called the insurance company and enrolled, you don't get that enrollment period. So that's a good out if somebody has joined a plan just to keep things quiet for open enrollment, but has not done the right thing with the provider. It's a good out, okay? But you have had to enroll on the plan finder and not through the insurance company, okay? HMOs, POS, point of service, same kind of thing. You've got to stay within their networks in order to do it. They run from 0 premium up into the PPO. I'm going to just look at Aetna. I know you don't. Sue has it. The HMO is 0 premium. What they call Signature Extra is 0 premium. Their Eagle Give Back program, which would give you back a certain percentage of a 185. They have programs that give you some of that back. And then they have the PPO, all 0 premium. All right? But your out-of-pocket exposure, it all sounds good, 0 premium. But if you had a bad health year, you can up to $10,000 before the insurance company is going to start to pay. All right, so if you're, again, insurance is an offset of risk, right? How much risk are you willing to absorb and how much are you willing to pay to push it off on somebody else? Most of us have more of an emotional attachment to our decision on our health insurance than we do with our automobile insurance. It is, to us, it means something, health insurance. But to these companies, it is a product. They're selling a product. Your insurance, if you bought yourself a new Lexus and you call the agent and say, how much is my premium going to be? And they say, no premium, 0 this year. What's going to happen when you drive up and you totaled your vehicle, what do you think they're going to say? Oh, geez, you got a $20,000 deductible. Nothing for nothing in this world. These Medicare, in my opinion, now this is, I'm going to step out of my role as SHINE. In my personal opinion, I have no bias towards any one of the companies, but I don't believe that these Medicare Advantage plans work in the long term. If we're 65 and we're healthy, we ride the bike, we do this, we're wonderful. It's then we're 68 and then we're 72. Something's going to happen to all of us at some point. The odds are not in your favor, and that's when I think these Advantage plans start to incur some obstacles for people, because they have the right to say, no, I don't think you need the knee replacement now, you should just get the shots. Well, the shots lasted for 3 weeks, and now you're limping around again, and they say, no knee replacement. You're owned by the insurance company. So Medigap, you make the decisions. If your doctor says you need a knee replacement, he signs you up for the surgery, you're done. With these type of plans, you need referrals, co-pays, permission. So it's something to think about. If you, in my opinion now, if you have a chronic diabetes, heart condition, that sort of thing, and you go to the doctor frequently, if you can afford it, I would stick with the Medigap plan, because you can have control. But many people don't, and that's the people who don't are the ones that I try to get onto that Medicare savings program to help defer those costs. Okay, does anybody have any questions? All right. Prescriptions, you hear a lot about prescription coverage. And we saved and we negotiated and we did this and we did that, okay? In 2025, this is the first year, they've put a limit on how much anybody is going to pay for prescriptions over the course of the year. So if you take Stelara, which was $27,000 every 2 months, you can't pay more than $2,000 this year. Okay. It feels good, it sounds good, but what they did, we're talking insurance. So if you had an insurance premium that was $30 and covered the Stelara for a certain, okay, and now they can't charge the full price, what do you think they did with the premiums? The premiums skyrocketed to offset the cost of the medicine. And the $2,000 does not include the premium. So you've got to do your own research, your own advocacy, find out each time you have some kind of prescription. You've got to look into the Medicare Plan Finder to see how it's handled. Many of those medicines, I get a lot of flack right now with Ozempic and Zepbound and, there's one more, Wegovy, right? Not covered. They were, for diabetes, diagnosed diabetes, they're covered, but then there was certain, I'm pre-diabetic. It's not covered. If your doctor cannot write a letter to Medicare or to the insurance company to say this person is diabetic, then it's not going to be covered for you. There was one, the newest one coming up the pike recently was Zepbound. I had never heard of it till about 6 months ago, and it wasn't being covered, except if somebody had what they called obstructive sleep apnea. So you could get your doctor to say, this person has obstructive sleep apnea, and it would be covered. Now, they caught on to that very, very quickly in 2026. They're not covered, okay? They won't be covered. So medicines are very, very, Eliquis is another big one. Eliquis was about $513 a month for individuals taking it during whichever part of the year, and then it might go down to $300. Well, you can't pay more than $2,000 over the course of the year. So they negotiated the price down from $1,300 retail to $900 retail. But if you're capped at $2,000, those behind-the-scenes photo ops don't really make a difference in your life. It sounds good, sound bites, but it's not really making any big impact for somebody who's limited to $2,000 over the course of the year. So, And then many of them lost their patent anyway, so they were going down to generic. So, what are you going to do? But I cannot tell you what plan out of the 15, I believe there's going to be 50 next year, which one works for you. It's only going to be based on your medicines. And that's why if you were going to do anything, we need that form back, okay? Anybody have any other questions, comments, concerns? We can take this in a few different directions, yeah?
Okay, if I have a Medicare plan, Advantage plan,
Advantage plan, okay.
and I sign up for a plan through one of these insurance companies, we're originally from Connecticut, we may be moving back to, we don't know, like mid-year next year, we could possibly be moving somewhere else.
Okay.
Would we still, another state? And we're already signed up for this insurance plan, are we still?
What is this insurance plan? Your PPO that you have with your
Well, I'm talking
employer,
about one of
the
these.
Medigaps? As long as you live in Massachusetts, you can buy it. You can take it wherever you go. You don't have to change. You can keep, as long as you're making your premium, you can keep it wherever you live.
Okay, so we
You cannot buy it after you leave Massachusetts.
You can't buy it, but you're still covered if
Yes.
you take it outside.
Yes, you can still
As long as
keep
you
it.
keep paying.
As long as you keep paying, you can stay. You cannot buy it
I
outside.
wanted to make sure they can't say, oh, no, you're
No,
canceled.
no, that isn't, the HMOs could, the Medicare Advantage can. The
Okay.
Medicare Advantage
My
can.
mother-in-law is 101 years old.
Uh-huh.
And she has a Blue Cross Rhode Island plan that she took with her and moved to Florida. And it's like, you can't even get this.
You can't get it. You can't get
They
it.
told her, don't even,
Yeah.
Don't, you can't. You can't do better than this. You can't do better than that. The only thing that you would be able to do is up it to the Sapphire if needed.
What about the doctors in Florida, or won't they charge?
And no, oh, you're talking about the over the, all right. Sue's getting into SHINE training, okay. In Massachusetts, if you go to the doctor, as we had, and I'm going to make it simple, $100 office appointment. We're going to do a $100 office appointment. You have Medicare A and B. Medicare pays 80%, so Medicare is going to pay $80, right? The doctor in Massachusetts has to wipe out the 20, all right? So I'm going to say Medicare approved $80. The doctor can't bill you for the 20 in Massachusetts. In Florida, he can bill you 15% of that. Massachusetts won't allow that. But other states will allow a doctor up to 15% of what Medicare doesn't cover. Okay? Of the $20, 15, yeah. Yeah. Massachusetts, as I said, has quite liberal, very, very, very consumer-friendly laws that are added to these insurances. Okay, but yeah, okay, Sue, you got recertified. You earned your keep, okay. All right. I don't know, I mean, who else is struggling with what they have or what they want, or any I know that you said, how it transitions from Mass Health to Medicare for somebody on that. I would need to know if he's on Medicare. If he's now on Medicare, as of January, he said he's going on Medicare, or you said he already has his Medicare card.
yeah.
All right? Mass Health will not allow him.
Right.
Mass Health always wants to be the payer of last resort. So if he's on Medicare, he's going to have to send a new application to see what particular program he may be able to stay within Mass Health. He might be eligible for that Medicare Savings Program if he qualifies. That would pay the $185. That would help him pay for the prescription coverage that he has to get now that he's on Medicare. So that would be a good, speaking to him directly, one-on-one, before I can answer, but yeah.
He pays something though, although he's on Mass Health. He pays.
And that's okay, but now that he's on Medicare, he's into a whole different
Yeah, I
world.
know, yeah, I know.
It's a whole different world. There's no carryover. Once you hit the world of Medicare, you're in a different world. Everything changes. Medicare, Mass Health always wants to be the payer of last resort. As any insurance company, if there's any way they can push a claim off to another insurer, they will. So yeah, that needs more specific with your son, to be able to understand exactly what's going on. Now, I can actually get onto the Mass Health website, so I can see what he might have, and I don't believe Sue can do that, okay? So,
question, so, you know, it's alarming to us because I have my card here, it's Anthem Medical Preferred PPO, Medicare, so we have to call and see if this is being canceled.
But that's.
No, you would have gotten notification. You would have gotten, they would have had to notify you by October 1st if that was being canceled.
Okay, all right, because that's why I was
They would've told me
asking
yesterday.
if this MedX
And they-
is different.
Yeah.
And they would have it.
But what you can't do is stay enrolled in that and buy a Medigap and a prescription plan. As soon as you go on and buy a standalone Medicare prescription plan, they would notify them that you can't stay enrolled in both. You cannot be on a standalone prescription plan and a Medicare Advantage plan.
And then the premium for this one would go down, because they.
You would not have that anymore. You would have to buy the Medigap and a prescription. You wouldn't, that would be canceled. But if you've got to give a hard look at it to see if it's going to work for you if you do move elsewhere. Who's in that network? I know it's a PPO, but how much is it going to cost you if you go outside of their assigned network? You know? Without seeing the specifics on the benefit printout, I wouldn't be able to answer
You can
that.
sign up for an account on the Medicare, on the.
Medicare.gov?
Yeah.
Good for you.
So we're in the process of putting all that info in.
Perfect. It's been down all day yesterday, and it's having trouble today. Jim just called me on my way here saying he can't get in. I'm like, I'm not surprised.
Yeah.
I'm not surprised.
Yeah.
Okay. Anybody else?
One more time.
No, one more time. Take it away.
Okay, so I'm the newbie, but, so if I have a group plan,
An employer group plan.
and I'm turning 65, I don't have to do anything.
How many employees are in the company? All right. Then you don't have to do anything.
Okay, so
You don't.
until I retire, whatever.
Until you decide to retire or they decide to retire you. Okay? So that would be, so if you enroll in Part A, just to get your foot in the door so you can understand how it works, you'll be assigned your Medicare number. Your card would say only Part A.
Okay,
Only Part A, all right?
but then I don't even have to do that.
You don't have to do that at all.
Okay,
Okay, at all you don't. If you had under 20 employees, then yes, you would, okay? But then it gives you the opportunity to set up a Medicare.gov account, all right? And should something change very quickly, because when you sign up for Medicare Part B, you only have 63 days to sign up for Medicare Part D, all right? Now, that's drugs, D for drugs, okay? You only have 63 days from your enrollment in Part B to pick up a prescription plan. It's a kind of an oxymoron kind of a thing. Part D is not mandatory, but it's mandatory. Because if you don't have it, you don't have to. But if you don't sign up and you're in the right time and you have to sign up later on, you will have a penalty, a lifetime penalty of roughly about between 30 and 33 cents right now for every month that you should have had one and didn't. So if you bought a plan that cost $6 and you didn't have your plan Part D for 3 years, you'd be looking at 33 cents times 36 added on top of your $6 for your life, lifetime penalty.
That happened to my sister.
Did it?
Yes.
Yeah, can you share that?
Her prescription, she didn't sign up in that period of time, and now her prescriptions for the rest of her life are more expensive.
Much more expensive. Not the prescriptions. The prescriptions are whatever they are. The
Yeah.
premium
The
is
premium, I'm
the
sorry.
premium
Sorry.
is added to whatever the
Right.
monthly premium is.
Right.
So it can get very expensive. I mean, myself, I get a little ticked. I've been on Medicare Part D since 2015. I don't take any meds. I've been paying roughly $125 a year for the past 9 years. Maybe I got an antibiotic because I got a sinus infection. But I could have bought that and still saved myself some money. But if I didn't, I'd have a lifetime penalty for the day that I need it.
Oh, yeah, they
Okay.
got you either way.
Yeah. It's a non-mandatory mandatory. That's the way I call it. Yeah.
You gotta assume you're losing a little bit somewhere.
Yeah. Anybody else? If I have not, go ahead.
Could I start out in core and then switch to Sapphire?
I said there are continuous open enrollments. You can, continuous open enrollment. So that is a little loophole. If you're on core, now let's just say, then I'm on core, all right? And I get hit by a bus when I leave here, and I'm hospitalized. I know I'm hit with the $1,697 because core doesn't pay it. I could be laying in the bed and they say to me, you know, we're going to need to do a lot more work on this leg. I can call Blue Cross and say, I want to move my plan up to Sapphire. It will start November 1st, because it's always the first of the month, but there's no questions asked. It's continuous open enrollment in Massachusetts. That doesn't happen out in the big world. If you go, and you can go from a Medicare Advantage one year to the Medigap the following year, back and forth, you have that option. Outside of Massachusetts, there are a few states that allow that. Most of them, once you go on a Medicare Advantage plan, you can never go back to original Medicare. So we're very, very lucky here that we have options. But as everything is changing, when will that change? I don't know. Okay. All right. Did I touch on everything? Because we can go in any direction anybody needs to.
May I ask a somewhat divergent question?
Yep.
But first, I want to pay you a compliment, if you don't mind.
No, I'm not good at taking them, but go ahead.
Well, only half of it's true.
Okay.
Well, what happened last fall is my 65th birthday was approaching. I joined this group, and I had read about SHINE.
This group?
The Elder Affairs.
Okay.
And I read about SHINE, so I called to speak to the SHINE representative, who was no longer here. And they said, well, here's Kathy's number. Right, which is kind of how you reacted when I called you.
Okay.
So I called out of the blue, and I said that to you. And I used to be a busy person. I could tell you were very busy. And I said what was going on, and you said that Sue had been hired and that I could leave a message and she would get back to me. Now, my first assumption was that would never happen. But then you said, I'm very busy again, and then you asked me all kinds of questions. 20 minutes later, you had answered everything I could possibly think of. You were sitting at your computer going in and doing things, and and then you were busy, and I said, thanks so much. And
Yeah.
let me say publicly, thank you for helping me out so much at that stage. And by the way, yes. And by the way, I called back, left a message for Sue, and she called me back within 30 minutes.
Yeah.
And she didn't even start yet, I don't think. So
That's because I trained her.
that was the very first thing she said. So anyhow, thanks so much for what you do.
Thank you.
Now let me tell you one other thing. I was really sick at the beginning of the year. I mean, really, really, really sick for many months. And I started thinking about having some sort of assistance at home. And I know there's a program, I think it's called a personal care assistant.
PCA, yeah.
But online, I don't understand even how you access it. It looked like it might just be for Mass Health.
Most likely for Mass Health, yeah. You'd have to be, if you're, each area has what they call an ASAP, which means Aging Service Access Provider. I don't know who it is down this way. Is it South Shore Elder Service in this area? South Shore Elder Service. I work out of the HESCO office up in the Walpole area. They cover different towns up that way. Mass Health, you have to fill out an application. You can get a personal care assistance and pay privately.
Sure.
But if you just log on, most of the stuff that you're going to get is basically a connection to a Mass Health service provider. You would not be most likely eligible based on your income. You'd have to be a Mass Health recipient. There's many, when I say Mass Health, there's not just one size fits all. There are a number of different Mass Health programs. So if somebody just says, like you said, my son's on Mass Health, I have no idea which one of the Mass Health programs he may be on, okay? That's why I said, if you send that in, I can look at Mass Health and see which program he's in and how it coordinates now that he's on Medicare, okay? Mass Health is income eligible. You can be, the only program on Mass Health does not look at somebody's income. They want to know what the income is, but they don't put it in their calculation on accepting you is Common Health, which is they have to confirm that you are disabled. And that would be the overriding factor to get into that. But mostly it's the PCAs, personal care assistants, are under for people who have certain mass health programs. You could buy a private nursing assistant.
Sure. But what I was trying to figure out, it looked like there was an outside agency that would handle all of the logistics. So let's say you qualified, you had a person, maybe a friend, a family member.
Okay, all right, that kind of goes into a different realm. So now if you went through South Shore Elder Services and you were eligible to get on a program that allows you to have a PCA through that program, that person can actually go on to another website called, one of them is Mass Care Link, and try to get certified as a personal care assistant. They could now, as a family member, get paid for if they're taking care of the person. But that is, again, a whole different process. I don't know what all the numbers are behind the scenes, but yeah. Other than that, the personal care assistant would come from South Shore Elder Services. They would be the ones that have provided.
But you have to be in mass health, period. That's
Mass health period to get that particular one, I'm assuming, but you can purchase your own
Sure.
through a private nursing agency.
But these companies are trying to sell people now that they will come into your home, take care, and you don't pay anything, and you don't have to be on this health, and they will get you to the state. And I'm saying,
I cannot, I mean, there could be out there, Sue, there's every kind of everything out there. You have to screen it. If you have specifics, let me know, search it, but
I say to be cautious.
I say be very cautious. You don't have to pay them anything, but they're going to take a look at what you got around your house and call their next door neighbor and say, I found a good one, you know, that kind of stuff. I don't know. I don't know. I'm being facetious, but it's out there. It's out there.
But I'm being negative. It's like they're saying that these are legit. Not but I say only Mass Health.
I say only Mass Health through your ASAP. Through your ASAP. Yeah. I don't know why Mass Health would just, or Massachusetts would pay for anybody to have a personal care assistant. Something doesn't gel. But if you could give me specifics, I can do a little research and bring it up on one of our next meetings.
the Attorney General would know.
Well, I don't know, because the Medford Housing Authority director just hit my car on the way down, so I don't know how I would trust. Yeah, my brand new car, 1,600 miles on it, just got hit on my way down. He goes, I'm from the Medford Housing Department. This is official vehicle. I said, you hit me.
Officially, you hit me.
I said, you hit my backside tire in your front car. I was going, he goes, well, I didn't see you coming. I said, you shouldn't have. I was already past you. You waited, you hit too soon. You should have seen me go by you. So anyway, anybody else have any questions? Because I'm open for anything. I can go on to, anything.
You want to go into Part B, how you get a penalty if you don't sign up on Part B?
I thought we had done that, yeah.
Well, maybe I had stepped up.
Okay, yeah, we had done that. If you don't sign up, you have if you lose your group coverage, you have 8 months to sign up for B. If not, you've missed your open enrollment and you'll get a late enrollment penalty. Same thing if you're not on group coverage and you wait, you turn 65 and you say, I'm not paying $100. I'm never getting sick. I don't do this. And you wait 5 years. You will have a penalty of 10% for every year that you didn't. So this year the premium is $185. So if I waited for 5 years to do it, I'm going to get whatever it is in 5 years. Maybe it's $300 in 5 years. I'm going to get $1,850. $20.60 for next year's premium. Whatever each year's premium is going to be added to my Medicare Part B. 10% of the premium for every year that you didn't have it. And that's, people say, oh, I can't believe it, I wasn't sick, I didn't need it. I understand that, the emotion behind that. But nobody would buy insurance until they got hit. Insurance companies are out there to make money, no doubt about it, but people don't want to buy it until they actually need it. So,
you said something to me about filling out this form and then give it to you.
You would give that to me, you could give it back to Sue, it doesn't matter. You could give it to your son to fill out so that I would know. If you need one for him, you would need, because if he's going on Medicare in January, then he needs to get a plan before January.
Yeah, right, yeah. But you said you could go online and get something about him. What did you say?
I said if you asked me specifically, if I was speaking with him directly, I could get his permission to look at his account on Mass Health to determine exactly what program he has and when and if he will be losing that, so we can figure out what to do around that. Sue cannot get on the Mass Health website,
So
but I
I
can.
should go through Sue.
You can certainly go through Sue,
and
yeah,
then
yeah.
I'll have her get you.
Yeah, yeah, okay,
Okay.
yeah,
Also,
okay, no problem, yep.
What is the price of the new Medicare premium?
I don't know, that's what I've said, I don't have that, it has not been disclosed yet.
Okay, I got it from somewhere, and I don't know where. I got $206.
If you go to Google artificial intelligence, it says $206.50. It possibly is right, but it has not been come down from the powers that be, so I cannot say it's going to be, but I don't want to, I can't. I can't. Until I get the official word of what it's going to be. I don't know what the Medicare Part B premium is. I don't know what the Part A deductible is going to be. I don't know what the Part B deductible is going to be. I don't have it. I have my guess because I've looked at AI and most likely, but I'm sure because the government is shut down, whoever is supposed to make that official announcement is furloughed. I mean, that's my only logic, right? Scratch my head. So from what I understand, the Social Security cost of living increase for anybody who's collecting is going to be average about $50 per individual increase. But the Medicare premium appears to be going up by $25. So it's $25 net in your pocket, really. That's it, from the cost of living. If that pans out. Until it's official, it's just a best guess, okay? All right. Anybody else? Any all set? Last question, okay.
All right, well, I'll ask this.
Okay, so everybody can hear, okay.
So if we're paying, our rates are gonna go up to $391
Each,
for our Medicare Advantage.
all right. And now that includes prescription coverage?
Yes.
Does it give you dental?
No.
No dental. What else is in there? So it's doctors, hospital, and prescription.
Yes.
And they don't give you any other benefits in there?
I think we have an eye exam every year.
Yeah, well, that's
Yeah,
that's-
yeah.
That's
And then, so on top of that, then we have 185.
You have the 185 each, right?
So we're paying $576 each, $1152 a month. Is that?
Nope, that is expensive.
Yeah.
But I don't know what impact your prescriptions would have if Medicare is going to be 185, and you can get the MedX at 133. Is that what it says here? The core 133, 142.
Yeah.
So now we got $400. I don't know what your prescriptions would cost. I'd have to look on the Medicare Plan Finder by looking at that form that I gave out to let you know what your prescriptions would cost. So you're probably pretty close to the same dollar amount. But on these, you can put your head on the pillow at night. You don't need to get referrals. You don't need to worry about where you're going. So you don't have to worry about if you're in Massachusetts, Florida, Texas. These are taken by every doctor who takes Medicare, which is 95% of all doctors, unless you get concierge medicine. But yeah, so you can take the worry about where I'm going to go off the table. But most likely, any retirement plan, if you drop out, they don't want you back.
Right.
Because you're only going to come back if you need insurance. That's what they think.